Hello, everybody. Welcome to another edition of our weekly webinars here from Premier Physical Therapy. My name, of course, if you haven't watched one of our videos before, my name is Curtis Pachoka. I'm a physical therapist here at Premier Physical Therapy. I graduated from University of North Florida in 2015 with my doctorate of physical therapy degree. And I was recently board certified in orthopedics, July of this year. So today's topic is balance and how we can help you. So I told you a little bit about myself, but now I want to talk a little bit about our clinic here. So our clinic is a privately owned practice. Our owner is a physical therapist. We have two locations, one in Jacksonville Beach, uh, near Beach Boulevard and Hodges. And our second location is in Ponte Vedra near Fairfields community near Palm Valley Road and A1A. Our subspecialties include orthopedics, jaw pain, head and facial pain, and also some lymphedema, running, and golf programs. So, is falling a common problem? Couple stats here. So, yes, it is a common problem because more than one third of adults 65 years old and older fall each year in the United States. 20 to 30% of people who fall suffer moderate to severe injuries. So, if you're tuning into this webinar, um, you yourself might feel that you want to know more about balance and falling, but you might know of somebody, either a family member or a friend, who has fallen before, or you see signs that they might be at risk of falling, which could include holding on to walls or trying to hold on to a person while they're walking. They're usually at a risk if they're reaching out for something with their hands for supports. Um, that's one of the hallmark signs of an early sign that someone could be at increased fall risk. So why do falls happen? 15% of all falls are unavoidable. Um, Accidents, maybe slipping, maybe an animal runs into you. So you can't control those. Those are just accidents. 15% are due to a single event, such as if you have a stroke or you pass out, you're going to fall. But the majority uh, is due to interacting risk factors, factors that can be improved that are in our control to prevent. And that's things like strength, balance, mobility, medical errors, mismanagements, as far as what kind of medications you're taking. They might have side effects if you're taking multiple medications. You could be prone to falling. Vision problems, cognitive impairments, depression, and the effects of multiple comorbidities combined. So you may rely on the following four categories, or you mainly rely on the following four categories for balance. So one of them is strength. If you are weak in your legs, you might not have the strength to maintain your balance when you stand or walk. Sight vision. If your vision is compromised, you're not going to be able to see certain items such as rugs on the floor, thresholds, different sorts of terrain, water, slippery water on the floor. And if you don't see, well, one thing is these masks too. When you're wearing a mask, you can't see your feet. And I myself have been actually tripping more. So this shows you how important your vision is. Your vestibular system, which is located in your inner ear, it's a system in your body that kind of tells you where you are in space, where your head is in space, controls your eye movements, controls where your spine is in space. And then you have the somatosensory system and proprioception, mainly in your feet. And it's your ability to use your feet to sense what you're standing on and to sense what your legs are doing in space. Those are all very important things that can be in our control to improve on. So these four categories work together to give you postural control, a complex interplay between the sensory systems involving perceiving environment stimuli and responding to the changes. So your whole body is just a bunch of receptors on your skin, in your joints. Your eyes are receptors to light. Um, so it's balancing is about using all your receptors in your body, then using that information to accomplish a goal, either standing or walking or avoiding a fall. And so you need the receptors first to get the input of what's happening to your balance. And then the output comes from your brain using your muscles to respond to that challenge and to prevent yourself from falling. But to summarize that, the ultimate goal is to maintain your body's center of mass within the base of support, which we're going to talk about in the next upcoming slides. So, good postural control means you are able to keep your center of mass within the base of support. These pictures are a little hard to see, um, but your center of mass is mainly the center of your body, which, for example, could be kind of where your belly button is. So if that area, your center of mass, moves out of your base of support, you typically are going to lose your balance. So your base of support are your feet. If you stand with your feet a little bit wider, your base of support's wider. Versus if you stand on one leg, your base of support has decreased. And it's up to you to shift your center of mass in a way to prevent falling. So the bigger your feet are, you're probably gonna have a little more base of support. Uh, a classic example is if you have a pole. If you have a pole and you put it upright, it's gonna fall over. But if you take two or three poles and put them together like a teepee type of position or a tent, they're gonna stand up because now they have more base of support. So more about the four categories for balance. Strength, that is one of the categories. So it's required to manage body weight. A few muscles that are really important are your quads. They help you transfer from sitting to standing, which is actually a dynamic form of balance that we're going to talk about a little bit in the upcoming slides. But it also helps to manage knee stability while walking. So if you have weak quads, your knees are going to have trouble holding you up while you're walking. And if they're extremely weak, you definitely could, your knee could buckle or collapse, and then you could fall. Your glutes are also important. They help manage stability while on a one leg. And you need to be on one leg to do certain activities, such as walking, stepping over objects, and stepping over, you know, to get into a bathtub or stepping upstairs. So, a really quick and easy test to determine if you're at fall risk is you stand next to a counter, you lift up one leg, and you see if you can stand on your other leg for 3 seconds without losing your balance. If you can do that, you're probably not going to be at a fall risk. And you really have to count 3 Mississippi type seconds, not 1, 2, 3. You really have to see if you can get the 3 Mississippi seconds. Um, and if you can do that, you're probably in good shape. Because in order to do these tasks that we do every day, such as walking, stepping over objects, you have to be able to stand on one leg while lifting up your other leg to take a step or to step over something. So if you're unable to stand on one leg for 3 seconds, you're going to have to shuffle your feet or not take smaller steps, basically, which puts you at a fall risk for tripping. Because if you are shuffling your feet or you're not able to step over objects, you might catch your toe on the carpet or a rug, and that could lead to falls. So your vision is really important because it sets a frame of reference for what the environment is doing around you. You can use that frame of reference to determine what position you're in. So if you see the floor and the walls and you see these lines, you can kind of gauge where you are according to those references. Um, they allow you to see the surface you're about to stand on. So if you see the grass or the sand or a puddle of water, it allows you to react to that. Allows you to detect light, um, and you use light to see everything around you. That's why at nighttime it's a little bit harder to balance because you don't have that frame of reference. It allows you to see movement and changes in your environment. Like we said, your body is full of receptors. Your eyes are a really important receptor, and they're so different than your other receptors because they rely on light and your ability to translate this light information going into your eyes and kind of think about what you're kind of all that light gets transformed into your brain to kind of determine what kind of shapes are around you, what kind of objects are around you. So you can see where the step is, how high the step is, uneven ground, a small dog running. Surprisingly, dogs are actually a big cause of falling. They're unpredictable. If you're walking them, they can run after a squirrel and pull you over. They can run into your feet while you're just walking around the house and trip you. I've had multiple patients actually get injured from falls because of their dogs. I love dogs though, so I'm not saying get rid of a dog or a dog's a problem, but it's something that we need to make sure you're top shape with your vision. That way you can avoid these falls and keep your dog. Peripheral vision too, that we talked about. The masks are kind of blocking some vision uh, below you, so you can't see what your feet are doing. But you want to make sure you have a good field of vision. So we want to make sure your peripheral vision is able to see as much as possible to give you the most advantage to walking and doing daily activities of living. So the vestibular system, it's located inside the inner ear. It is made up of three semicircular canals and two otolith organs. Each of these semicircular canals relay information to the brain about where the head is in space. Each canal also relays information about different planes of motion. So your vestibular system is another form of receptors that tell your brain important information, but this tells you where your head is in space, unlike your eyes, which do a different form of reception. So the knowing where your head is in space is extremely important. Um, you want to know um, when you're walking around and you're moving your head, you want to really have a good idea of where your head is. And this system in your ear is extremely important for that. It works with your eyes and with your neck and with your spine to keeping your head basically on your shoulders. Um, that's one of the most important things with balance is being able to keep your head in a level field, make sure your head is in a good position. That way you can react to the daily challenges of life. So this chart here shows what the vestibular system is responsible for. If you tilt your head one way, and your body doesn't know about it, it can really throw off your balance, or vice versa. If your vestibular system is compromised, it could be telling you false information about where your head is in space. So you might think your head is turning one way when it's actually straight, which can allow, if this is happening while you're walking, you can run into walls and things like that. So that's where this is extremely important, is your vestibular system can tell your body where your head is in space without relying on your vision to do so. So the next important part of the balance system is, what is the somatosensory system or proprioception? It's described as the sixth sense. It's using proprioceptors, mechanosensory neurons located within tendons, muscles, and joints. So these are other receptors in your body, but they are located in your skin, in your tendons, in your muscles, in your joints. So what these do, particularly at the bottom of your feet, is tell you what surface you're standing on, but they also tell you what your feet are doing without looking at them. If you're not looking at your feet, are you able to determine if your knee is bent or straight? This is really important when you're standing. And like we said, if your vision is compromised and you don't know what your legs are doing, if they're bent, if they're straight, if you think your legs are straight and they're actually bent, you might trip or fall over. Or if you think you're bending your knee to lift it up to step over something and it's not bending and you don't sense that, that's going to lead you to trip and could lead to falls too. So your ability to sense this information with your receptors is highly important to your ability to avoid falls or tripping. So, a little bit what we discussed, the mechanoreceptors tell the brain where our joints and muscles are in space without looking at them. That way, if it's at nighttime, it's dark, you cannot see the ground, you cannot see your legs. These receptors will tell your brain where they are in space without relying on your eyes to do so. It even can tell you if your joint is moving or standing still. That is highly important. If you did not have these receptors, if you did not know if your leg was moving or not moving, or if you couldn't feel any of that in your legs, it would be nearly impossible to walk without compensating. And you could compensate, but it's going to require very good vision, very good strength. You're going to have to rely on the other systems to do so. So the brain uses this information to respond appropriately, adjusting to an uneven surface. If it senses the grass is uneven, your body will have to adjust the center of mass to make sure it doesn't fall out of the base of support and you lose your balance. Adjust the speed of movement to navigate an obstacle. If you have an object in the way, you're going to have to make a decision either to step over it or to walk around it. And using this sensory system is crucial to accomplishing that task. So, how does the body use these systems to react to changes in the environment? So, you got a couple strategies your body uses to avoid a fall. So, if you have a force on you, you get pushed, you get nudged, and you get pushed one direction. If you get pushed forward, you have to rely on your ankle and hip strategies and stepping strategies to avoid a fall. So if it's a little nudge and it pushes you forward, your ankles can adjust and bring you backwards. It's a big nudge. You can use your hips to get your center of mass back into your base of support. But if you lose that center of mass completely and it falls completely out of your base of support, you're going to have to take a step, and you can use this step to correct your balance. So a little bit what we just talked about with your ankle, you're going to sway a certain direction to avoid falling. Same thing with your hip. You're going to stick your hip, either stick your butt backwards or stick your hip forwards, or even lean to one side or the other to correct your center of mass. uh, into your basic support. And then when you're about to fall and you might not have any other choice but to use a stepping strategy, which you have to take a step. You can't just wiggle your hips around or wiggle your ankles around. You're gonna have to take a step to prevent that fall. So each of these systems and strategies are important in order to feel stable, both when you are still and while moving. So static balance is just standing on a surface, could be uneven, but you're not moving. Could be closing your eyes while taking a shower, could be standing on one foot, could be standing without holding on to anything. Dynamic balance is totally different. You're moving the whole time. So that's going to be hiking up and down slopes, ramps. You have stairs, walking, transfers, sitting to standing, like we talked about earlier. So, what does a balance assessment include? So, this is where physical therapy becomes very important. Us as physical therapists want to prevent falls because falling can lead to injuries. You can bump your head during a fall, and it can cause a brain bleed. You can fall and break something like a hip, and that could take a long time to recover from. So the best way to do it is to prevent it from happening in the first place, because trying to do therapy falling is a lot harder. Because for one thing, you're gonna have fear of falling, and ironically, fear of falling is a risk for falling. So the more you fear falling, the more likely you are to fall. Which, if you do fall, you're gonna be even more afraid of falling, and then it makes this circle that gets worse and worse and worse. Um, so what we do for physical therapy, we test your strength in your legs. Is it adequate? If it is, then we move on to other things. Posture. Do you lean too much on your tippy toes? Are you leaning backwards too much? That can be a problem. It can really lead to falls. So we want to make sure you're standing with the best center of mass over your base of support to ensure that you're not at a higher risk of losing that and causing a fall. Sensation. We have a test here where we have this monofilament, which is fishing line. We put it on the bottom of your foot to see if you can feel it. Because if you don't have sensation on the bottom of your foot, you could have neuropathy, peripheral neuropathy, which means you just can't feel the bottom of your feet. So that creates an interesting challenge with your balance because you might not ever get that sensation back, but there are ways to still get better in balance. You have to compensate with the other systems of your balance, with your strength, with your vestibular system, with your vision. We have to make sure the other things you do have are in top tip top shape. Range of motion. If you're lacking a lot of ankle and hip range of motion, you can't do ankle and hip strategies to correct your balance. So that involves stretching to get that range of motion. Gait, like we talked about, if you can't stand on one leg, you're going to shuffle your feet, and that's abnormal gait, and it can lead to falls and tripping. Balance testing. We have multiple ways to test your balance, and they are standardized tests that what we can do is put you through these tests. It'll take, 20 minutes or so to complete. We then grade those tests and they give us a score. And there's certain cutoff scores, but what those tests will tell us with the best research on these tests, they'll tell us, are you at risk of falling or are you not at risk of falling? And they'll tell us what areas of the balance systems you struggle with. So that way we can develop a plan to address the systems you're weak in. Because you might be good at your strength, you might be good in sensation, but you might have bad range of motion or a bad vestibular system. So we would want to work on your individual deficits and make a custom plan for you. So what does treatment include? Like we just mentioned, it depends on which impairments determined in the evaluation, which impairments that you as an individual struggle with. Those are the ones we want to work on. So each treatment plan is individualized. It's not the same treatment plan for every balance patient. I've never given the same treatment plan to any patient. It's all custom based on the impairments and deficits we find in your first day evaluation. So we don't give you anything or just standard exercises. They all have a purpose and an intention in mind. So problem area with treatment examples. So if you strength, we're going to do strengthening exercises. If you're lacking range of motion, we're going to do stretching. If it's static balance you have trouble with, we're going to stand on even uneven surfaces, maybe change your base of support, stand on one foot, stand on squishy things, stand on ramps, stand with your eyes closed, eyes open. Maybe we'll have you turn your head. We're going to do everything you need to improve your static balance. Posture, make sure you have good posture, especially if you can stand upright. Make your gait more normal. So if you're shuffling your feet, we're going to need to change that. Maybe you need advice on an assisted device. Like I said, if you're reaching out for things and you need to hold on to the walls while walking, you're at a risk of falling. And if you do fall, you're going to have a fear of falling. And then if you have a fear of falling, you're going to be, it's even more of a risk of falling because you're going to rely on more things to hold on to and take smaller steps. And then if you fall again, you might break a bone. And then, so to prevent all that, you might be a person who just needs a walker or a cane, just a little bit of help with walking, which is way better than the alternative, which is breaking a hip or hitting your head on the floor, because then afterwards you're going to have to. It makes it a lot more challenging to work on your balance after you've been injured, because you're going to have a lot more systems compromised. If you hit your head, your cognitive system might be a little iffy, and if you break your hip, you might have stiffness and weakness in your hip, which would make balance even harder. Um, and then dynamic balance, that is balancing while moving. So stepping over objects, navigating uneven surfaces, turning directions and changing directions, turning around, turning in a circle is tends to be a difficult problem for people. Transferring from a chair, standing up from a chair, getting out of bed, those are big areas where people can have trouble with. So these could be some specific goals you may want to work on. If any of these are troublesome for you, then physical therapy can be a solution to help. Um, so getting in and out of a bed or from a chair, feeling confident walking to the restroom in the middle of the night. Confidence is a big thing. When you come in for balance, we give you a confidence scale, which is your personal rating on how confident you are doing things like walking in the middle of the night. And the more confidence you have, the less risk you are falling. Because if you're at a fear of falling and your confidence is low, you're going to be hesitant to do the normal movements, and that makes you at risk for falling. So picking up items from the floor or reaching overhead into a cabinet, turning around or looking in different directions while standing or walking. That's the vestibular system. If you're turning your head and you don't know where your head is in space, you could get dizzy and fall over. Walking on uneven terrain that uses your receptors in the bottom of your foot, going up and down stairs, uses a lot of strength and your ability to sense how high you're lifting up your leg. Navigating obstacles in and out of the home, rugs, threshold steps, that's going to involve a lot of things, but your vision is really important to see the rug, to see the threshold, and then to accomplish the task by lifting your foot up a certain height to avoid that step or threshold or rug. Standing tolerance, if your muscles don't have strength endurance, you can only stand for a couple seconds at a time. It's going to be tough for you to walk or do these activities like cooking and cleaning and showering. Walking tolerance, walking in a grocery store might take 30 minutes. So if you can only walk 10 minutes, that's going to be a problem. You're going to need to rely on a shopping cart, and that might not even be enough. So you want to work on that endurance and tolerance. Gardening, yard work requires a lot of pulling and lifting and bending. So that could, when you're lifting something or pulling something, it's going to shift your center of mass out of your base of support, and you're going to have to compensate or react to that change in order not to lose your balance. Getting up from the floor by yourself, that is huge. So one of the things we do here is we train you how to get up from the floor by yourself without holding on to anything, and see if you're able to do that. If you're unable to do that, we might have to, make a plan for trying to avoid doing things on the floor. But you'll be surprised, a lot of people actually, once they get over that fear, they're able to do this task by a strategy that we teach you to use tactics to be able to get off the floor without using anything to hold on to, and to do it on your own independently. And that will make you feel really good. Once you learn how to do that, you feel a lot more at ease that you're in control of your life. You have your independence. And then return to dynamic activity, more high level stuff. Some people want to golf and play tennis and do speed walking. So sometimes your balance is good, but not good enough to do these activities. And physical therapy can still get you there. All right, so you currently have three options. So decisions have to be made, whether it's you or a family member. If you feel like you don't have confidence and you feel you're at a risk for falling, or if you've fallen in the past, what you need to decide on is if you want to take that next step and come into the clinic for an evaluation. This is what we were talking about earlier. The assessment lets us assess your balance. We get to grade it. We can tell you if you're at risk of falling or not. Um, and then we can determine a plan for you after that. It can be a great investment because, like I said, it's much easier to prevent something than it is to try to fix something after you've had a fall. It's much easier to prevent a fall from happening in the first place. If you're not comfortable coming into the clinic, telehealth could be an option where we can have a consultation via webcam, and we can still try to get in some assessment and maybe just kind of talking over what kind of things you can do on your own without having to come into the clinic. Or you can start with the education that we provided today. This will go onto YouTube later on today. And when it is on YouTube, you can watch it as much as you want. You can skip through some things, get to the important stuff. You can also post comments on the YouTube page or in the comments section below. And what I'm going to do next is actually look to see if there's any comments. So this will only take a second. Kind of talking over what kind of things you can do on your own without having to come into the clinic. Oh, I see Rose made a comment mentioning fear of falling. Yes, fear of falling is a huge risk of falling. So it creates this really bad circle where if you're afraid of falling, you're going to take smaller steps and it increases your chance of falling. Then if you do fall, you're going to have even more fear of falling. Your confidence is going to go down even further, and which keeps on making risk of falling worse and worse. Risk of falling. So it creates this really bad circle where if you're afraid of falling, and then I see Rose with another comment thanking us. Well, I want to thank y'all for tuning in today and taking time out of your day to watch this video. And like I said, it's going to go to YouTube. So go to our YouTube channel if you want to watch this again or show it or share it to a friend. Leave your email in the comments below if you want us to reach out to you, or you can email questions to info@premierptject.com. Other than that, have a good day. Thank you again. And until next week. Goodbye.